sports-related head injury and concussion is the topic. Kind of a personal interest of mine. I played a lot of sports growing up, and then I've been a trauma surgeon. And one of the cases that I think illustrates kind of where we've come with this disease process is this one. So this is in San Diego, where I was working 10 years ago. And Mike Cameron was the center field, or was the right fielder for the New York Mets when they were playing the San Diego Padres. And the trauma center I worked in San Diego was the receiving area for the stadium. So Carlos Beltran was the center fielder for any of the sort of baseball fans, and they got into a collision, and they came to me as trauma patients on the night that I was on working at Mercy downtown. And it's interesting that at the time, for Cameron, the focus was on the management of his facial fractures. He had some facial fractures that were going to require operative fixation. He was going to be out for 6 weeks. I think when I went back and looked at the news articles surrounding his injury, in the New York Times, the New York Daily News, the San Diego Union Tribune, there was probably the word concussion mentioned once in one of the many articles about that. And with regards to Beltran, he returned to the game, and afterwards they told him, you know, he didn't remember the event. It was just two tough guys going at each other, and you know, well, he kept on playing, and he was lauded for his determination and toughness. And so I kind of think that's only 10 years ago, right? That's kind of where we were. There was virtually no mention of kind of concussion, or if so, it wasn't mentioned frequently. So for today, I'm going to talk about a little bit of the definition of MTBI, mild traumatic or minor traumatic brain injury and concussion. We're going to talk a little bit about treatment, talk a little bit about California legislation, and I'm also going to talk a little bit about some of the pathophysiology behind it. I have no disclosures. Within this, there are variations. There is traumatic brain injury, true brain injury, and we see that. And patients afterwards may feel what we term concussed. There is MTBI, or concussion, where we may not see something on the imaging, but who may have similar, if not identical, symptoms to those that do have imaging findings. And then the thing that's in the literature or in the public's eye is the chronic traumatic encephalopathy, which may be the end game of this disease process, which is frequently what we're seeing with regards to the NFL players, and where we think that the worry of what all of this can lead to evolves to. So this is a girl that we saw in the trauma service. She's doing what's called a sit spin, and there's this very dangerous period where you're doing that down and around, and the ice, I'm told, is very hard. So that when you slip on the sit spin and you hit the back of your head, because I've never seen a helmeted ice skater, you can hit the back of your head. So she has what we see here as a small linear skull fracture, and she's got a little bit of sort of trace amount of blood, and she has a brain injury, right? But her symptoms after that persist, and she has double vision, dizziness, her balance is affected, she's got a loss of concentration, and it took her 3 months to resolve. And I guess what I'm going to advocate is when we're talking about concussion, we're talking about a minor form of this, which can mirror this. And in this case, there's the young man who's up over here on this corner. He's getting flipped up, and he's landing on his head. And so he goes to an emergency department, and he has a head CT, which is negative, but he had essentially the same symptoms. He had a headache, he had nausea, took months to resolve, and was hard for him to concentrate in school, if not perform at all. And that, for parents, can be quite stressful in that sophomore, junior year when all the grades are being aligned for future. So the question is, does he have a concussion? Well, what's the definition? What should they do with him on the sidelines? Is it a legitimate injury? And then what all the kids ask is, why can't they just go back in the game like Tom Brady? So this is happening seemingly all the time. This was something that this goalkeeper, Hugo Lloris, plays for this English team, Tottenham, and there's this guy, Romelu Lukaku, who plays for Everton, and he hits him in the head with the knee. So the problem right now, in part, is while we're also trying to learn about the disease, we are a little bit schizophrenic on the messages we're sending about the disease.
How's Hugo Lloris? He still doesn't remember the incident with Lukaku, so obviously lost conscious there, and difficult moment for us to take. But he seemed very assertive and determined to continue, and shows great character and personality. So I think we decided to keep him on based on his determination, and I think that was the right decision.
If he still doesn't remember the incident, should he really have stayed on the pitch?
Yeah, I think so. I mean, you see that the player is focused and driven. Obviously, it was a big knock, but he looked composed and ready to continue on. So we allow that to happen.
So that is kind of where we are right now, right? We have a knowledge of some disease process, and yet in the professional or the adult levels, we continue to tell kids mixed messages. And this is in the World Cup final in 2014. This guy, Kramer, who's in the white, who was playing for the German team, was actually in the game because the starter was injured. And so he's the backup in a World Cup final. And he's essentially, he doesn't know who he is, he doesn't know what he is from the sideline evaluation, and he was kept on the field for 5 minutes after that. So that's kind of some of the stuff that we're fighting against kind of right now. Is it an epidemic, or are we more aware of it? That's kind of one of the thought processes that's going on right now. I don't know if the older folks, me included in the audience, if you remember Jim McMahon, he won the 1985 Super Bowl with the Chicago Bears. Has had very profound post-traumatic symptoms. Keith Primo plays the captain for the Philadelphia Flyers, retired earlier from post-concussive symptoms. Taylor Twellman, U.S. men's national team soccer player, retired early because of symptoms of concussion. Cindy Parlow started 6 games in the 1994 99 Women's World Cup that sparked the sport in the nation, retired early of concussive symptoms. There are books, there are movies. The topic is increasingly something that we are aware of. And of course, Junior Seau, suicide, when they did the autopsy on his brain, demonstrated findings consistent with the chronic traumatic encephalopathy. So is it an epidemic? Is it something that we're more aware of? How does it happen? These are some of the issues that we're talking about. Time magazine from September of 2014, talking about young athletes in the sports. Should we be allowed to play the sport? Interesting question. The NFL settled $1 billion lawsuit for concussions. It's all over the current sort of news. Is it new? Not so much. In the first reference to chronic or brain injury related to a sporting event is from JAMA in 1928. The topic of the article was called Punch Drunk. And it talks about the linkage between case histories and autopsy data in boxers. And it validates a linkage between head trauma, concussion, and dementia, and at that time called for public tracking and statistics to change policy. Seems almost like where we are now, maybe 80 years or 90 years later than where we were there. In the popular culture, I think Sylvester Stallone is trying to portray someone who is got an element of punch drunk. It turns out he also has Bell's palsy, which affects his speech. So it's not as though some of that is just him. And then the other is Marlon Brando on the waterfront, a good example of a punch-drunk boxer. So we've known about the linkage between brain trauma over a chronic repetitive time and its effects, but it seems like it's only getting more relevance or interest now. Why is that? Well, if you look through time, that gentleman on the right, and I'm forgetting his name, won the 1912 100-meter dash, okay? I just pause on that for a second. When you look at Jesse Owens on the left, you look at Bob Hayes in 1960, Carl Lewis in the 90s, and then Usain Bolt. I'm pretty clear on who'd win that foot race. I'm not sure if we'd put the 1912 versus the 2012 London Olympic champion. It's pretty clear that things have evolved or changed. And that goes across sports, right? That's Nadia Comaneci, and that's Gabrielle Douglas, who won the, bigger, stronger, faster, higher impact, higher collisions. And that's a product of what has happened in our society, right? There was a fitness craze in the 80s. It became popular to be fit, and people start continuing to be active and athletic in more varied and wide ranges. And ultimately, we're at a point now where we're taking it to almost a technologic level to improve fitness, both amateur and professionally. And ultimately, everybody's getting bigger, stronger, faster, or the side effects of being American. And this is kind of where we're at. When you look at the impacts that are happening in athletics today, this is Ray Rice, who's a future Hall of Fame middle linebacker, and that is completely, Ray Lewis, completely clean, completely legal, tremendous amount of force in that event. So the size of the issue, when talking about the adolescent side to things or the youth side to things, there's a population of roughly 70 million children and adolescents in the United States, of which 30 million or more participate in athletics. Annually, about as many as 1.5 to 3 million children may suffer a concussion. What is a concussion? Well, the consensus statement has stated that it's a complex pathophysiologic process affecting the brain induced by traumatic biomechanical forces. And that's kind of a little bit vague, that it doesn't speak to sort of something that is very helpful at the bedside. What we are left frequently is the symptoms, which are frequently headache, nausea or vomiting, balance issues, dizziness, light sensitivity, feeling foggy, hazy, insomnia, or the opposite, hyper sleeping. And the signs of a concussion are dazed, confused, and disoriented, or inappropriate, depressed, or irritable, and that in the age group in the adolescents can make that very hard to sort out, if you kind of get where I'm going with that. So among the proposed mechanisms is force. And there are two types of forces that the brain is typically exposed to in athletic events. There's the linear, which is where somebody gets a direct impact to his head, sort of falling to the back of his head, or direct contact. And then there's rotational, where that Ray Lewis, that side to side, the head is on a swivel and the brain is floating within the skull. And that rotational force, you didn't get directly hit in the head, but it's the rotation of your head on its axis where the brain is getting moved within the skull with a quick deceleration. So there's linear, direct force, and then rotational. And those are sort of the two biomechanical forces that are felt to be involved with the process of the development of injury. At a cellular level, and this is taken from something that's a little bit more severe, meaning axonal shearing or diffuse axonal injury, there's a tearing of sort of at the axonal level elements of it. And there's an excitatory process and a remodeling of the brain that's occurring in the area that's injured. And that, I believe, is occurring also at a smaller level, probably with these repetitive minor injuries, where there's these little shearing events, these axonal shearing events from that linear or rotational force that results in damage to a focal area. And what we see at the end result of this is the deposition of a protein found in the tubular structures called tau protein. So on the left is the autopsy specimen of a 65-year-old man, and it looks kind of normal for 65. The one next to it is a 45-year-old linebacker, all-pro NFL player who committed suicide and has both involution and chronic atrophy, but also lots of deposition of this tau protein, which we think may be associated with degenerative or repetitive injury. This screen over here is an 18-year-old who committed suicide, but who had played highly competitive football, including college football, and shows early signs of deposition of tau. Now, the question is, are these observational or are these true events? And by that I mean, we're autopsying the people that we know who have had the problem. We haven't autopsied enough people who haven't had the problem to know what the normal incidence of this is. So we need to stain 1,000 18-year-olds for tau, many of them who haven't had chronic repetitive force to the brain, to know if what we're seeing is a correct signal, and we're in the middle of this. but it is worrisome or suggesting that there may be a pathophysiologic process occurring at the cellular level resulting in permanent injury. And this is similar to what we know occurs in other disease processes, for example, Alzheimer's, where you get phosphorylated tau changing over the course of the progression of your neurologic disease. So the deposition of the protein is kind of a fundamental event that comes in neurodegenerative diseases. So again, what causes concussion? Well, one thought is force, and that's linear, rotational, those two things I talked about. And then the other question is there's just a threshold force that if I expose somebody above a certain level to force either rotational or linear, that everybody's going to get a concussion. Or is it none of the above? And that's kind of a provocative question, is that maybe it isn't force, but maybe there are brains that are sensitive to force, so that maybe one person would get a concussion at any force and another person won't. And so limiting force in athletics may not be the solution. But we need to explore force a little bit. So this was my initial idea with the IRB. So my proposal, sign up 100 kids, we'll hit them with a hammer 10, 15, I don't know how many times. Cottage is a very restrictive, conservative IRB, and they didn't sign off on that. So, but we're still hopeful. What we did instead...
Time. The Vaqueros are sporting a new look this fall, and the headbands aren't a fashion statement.
The metal thing has to be on the back. Just face it. Well done.
Play. The bands are actually monitoring any blows to the head that an athlete might receive.
The company that provided it was Triax, but ultimately this comes from the Sports Legacy Institute, which is one of the biggest research groups out there and a coalition to try to address the head injury problem and the concussion crisis that's going across the country right now.
Santa Barbara City College men's and women's soccer, as well as men's and women's basketball and the football team, will wear these headbands during practice as well as the games. This is how it works. The athletes will place the bands around their head, and
these little devices capture every single impact that a student athlete may experience. And they upload that information in real time to what's called this aggregator, and the aggregator ultimately can send out text messages.
SBCC is the first institution in California to implement the hit count headband. Now, Cottage Hospital helped by presenting a grant for 80% of the cost to the junior college.
Our number one goal is really the safety of our student athletes. A secondary goal with that is to really help the research process and to better understand the problem that we're facing.
It's helpful towards us, as you know, we want a healthy team, we want to have a good season, so we want people to stay eligible healthy-wise.
And you're stylish too, right?
Yeah, it looks awesome on me. Just saying.
I knew that was a little long, but it kind of described a little bit what we were doing last fall, which was I had my rats, my subjects, wearing the headbands, and they were hitting themselves with hammers on a regular basis. So that actually did pass. So that's the headband on one of the football players. You're getting the idea. They're wearing them under their helmets, and the soccer players are kind of wearing them continuously as well. And so we gathered some data from that. And this is the football data, and we had 34 participants with a mean age of 19 and a half. We took data from games. What we found was in practices, if they were wearing it on their hip and they're jogging and the sensor bangs on their hip, that was actually some of the highest recorded impacts that we had within the study period. So we had to figure out a way to take the noise out of the signal to understand, and that's a weakness of the study, no doubt, but I had to have reliable information to eliminate what were the noise events. We found that for the 34 participants that they on average had about 80 hits during the season. Now, we set a threshold of 60 Gs as what we would call a hit. So on average, the 19-year-olds playing football are being hit with force over 60 Gs 80 times during the season in games alone, which is kind of an interesting observation. That seems like a lot to me. And then we looked at the means for the maximum of the event. The average maximum G force that a kid got hit with was 82 Gs. And then there's rotational and acceleration, rotational velocity, trying to get that measurement of the angular effect rather than just the linear effect. And then we looked at the cumulative force that they were subjected to over the season, which is close to 4,000 Gs on average. And just to put that in perspective, the shuttle launch submits those launching to 3 Gs. A fighter pilot doing a barrel roll is about 4 to 5 Gs. A roller coaster plunge is about 5 Gs. A car crash, maybe 35, 40. A heavyweight puncher getting struck in the head or punching someone in the head is about 60 Gs. And our kids are getting hit 80 times with 60 Gs to 100 Gs with the max average of 80 Gs. And that seems like a lot. So what we tried to correlate that with was neurocognitive testing or neuropsychologic testing called the impact test. And they go through a number of responses, visual, spatial, memory, and it's they sit in front of a computer terminal and they take this test, which has 100, 150 questions. And we did this at the beginning of the season, and we did this at the end of the season. And then we tried to correlate their force data with their results on the testing. And this is a kid who actually had a concussion during the course of the season. So they come up with this sort of aggregate cognitive efficiency scale or index. And he dropped in every category pretty substantially in his reaction time, his motor speed, his memory, and his verbal. Now, it's hard to tease that out a little bit to know whether the kids are racing through the exam at the end of the season because they were forced to do it. So that's hard to account for. That are they checking a box before they can call the season over that the coaches are making them do? Are they truly participating in the same way that maybe they did at the beginning of the season? That's a legitimate question. I can't answer that. And this is another one where there's less of a difference, but there may be a difference. So we thought we saw some maybe differences in cognitive efficiency between the preseason and the postseason. Maybe their cognitive function was declining on the neuropsychologic testing. So the question is that related in any fashion to what they were undergoing in terms of trauma to their brain during the course of the athletic event? And so we looked at if they had a greater than 10% drop in their cognitive efficiency, could we correlate that with the amount of hits? And while the kids who were hit more seemed to have a greater drop in their cognitive efficiency, the noise or the deviation within the number of patients that we had precludes from making a comparison based on that. You can't draw that conclusion with 34 study participants. Maybe there's a signal, maybe there's not. I can't tell it from this study. Similarly, we looked at the cumulative force that they were exposed to during the season, and those who were experienced to a little bit, who had cognitive changes in cognitive function seemed to have been exposed to more force during the season in a non-statistically significant fashion, and I can't draw a conclusion off that. So there's not enough patients to draw that kind of information. And then paradoxically, or just again speaking to the fact that this study couldn't answer these questions, was the maximum amount of their individual hit associated with cognitive function changes? No, but that makes sense kind of. I don't think one hit alone during one event during the season would really do it, but that was a question we asked. For those kids who had more than 100 hits in the season, did they seem to decline more or not? Hard to tell anything from this with the numbers that we had. So I can't tell anything. They're small numbers. It was, I think, a sort of a feasibility study that would need to be done at a multi-site approach because we'd probably need 5 to 10 times. We need to power the study based on the preliminary data to truly further investigate this question. And so I'm happy to take questions about that later on. Just as we go through some of the other areas that are hot topics, in youth, there are gender differences. Women seem to have higher concussion rates when comparing similar force. So if men and women are playing soccer and both submitted to the same force, women will report higher rates of concussion than men. Why that is unclear. Whether they're more honest than the male counterpoints, that's a possibility. Also, what has been discussed is that there's a different neck muscular structure and that women may get exposed to more rotational force than their male counterpoints. So it's hard to know. This is Cindy Parlow. So we do know that being active in women's sports does submit you to significant exposure to force. So that could be, again, youth in general. Why do kids seem to have disproportionately higher rates of concussion than adults? More rotational force with weaker neck, maybe. And another postulated pathway has been that the young brain is busy with ongoing development and has fewer compensatory mechanisms. These are all postulated pathways, and in fact, most of this talk is based on postulation rather than on evidence. The science is still evolving. As I said, it's been 10 years ago, we weren't even talking about it. Now we're talking about it all the time, but the research has to catch up to it. So what do you do if you have an athlete who seems to have suffered from some event? Well, there's essentially zero data, so let's start out with that point. But what we talk about is brain rest, recognizing that students in particular may have special needs, meaning that they may need modified attendance or work sort of schedules. Patients may have irritability, fatigue, and issues with memory. And I should comment a little bit about second impact syndrome, because this is something that you read about in the literature. The idea that why is brain rest conceptually important? And if we think that there is this period after an injury where recovery is occurring, where I was showing those sort of axonal shear, and then there's this injury, and then there's this period of remodeling, which may be occurring sort of theoretically, layering a second injury into that recovery period may be associated with the development of a more malignant event, like a sort of malignant intracranial pressure development. And that's in the absence of having what is seen as a true traumatic brain injury on the CAT scan. So you don't have a subarachnoid, a subdural, or epidural. All you have is a kid that was struck twice in a short period of time, the second one occurring after the first one occurred, and the kid went back in the game. And the example of this is a kid by the name of Zach Leistat, who is from Washington State. He was playing 8th grade football. He was struck the ground after a tackle, had no loss of consciousness, but they called a timeout because it looked like a big hit. He returned to the game 3 plays later, had a second impact, and then developed a more severe problem requiring decompressive craniectomy, tracheostomy, and gastrostomy. And that was felt to have been the consequence of having a second injury layered into recovery time after the first. So the reason why you take kids out and what has translated into laws surrounding it is the small but potential risk for the development of second impact. And the Leistat laws, which have been populated around the country, require schools to educate parents, athletes to be removed from competition, and not to be returned to play until an athlete is evaluated by a licensed healthcare provider. And these are pretty much all over now. I don't know if that last state has turned kind of blue yet, but and I'm not sure what's going on in Mississippi, but that's another issue. But anyway, but California's law was signed into law in October of 2011 and applies to any organization that uses facilities or grounds. So the one issue with that is what constitutes a licensed healthcare provider experienced in the management of concussion who should be evaluating children before they return to play. To me, that sounded a little bit like an unfunded mandate, and I didn't know how that was going to play out. So we put together a concussion clinic at Cottage with some assistance from the Jody House, the brain injury support center in town, and we provided a free clinic to kids who had concussions. And we've done that now for about 4 years. And we applied a graded return to play strategy based on concussion grading. Concussion grading I won't go into because it's actually fallen out of favor as a tool because the experience of symptoms is so varied and not typically dependent on things like the amount of time that you lost consciousness for at your index event. So what happened at the event may not predict how you're going to experience your symptoms in recovery. So what we did that year, we've actually kind of moved away from. But we saw that year Most of the kids that we saw, just about all, were from football. They had headaches, usual difficulties concentrating. We returned them to play in an average of 17 days. Most kids took 1 or 2 office visits, and that's generally speaking what happens. You put them into a brain rest approach. 90 to 95% of kids are done with it within a week or 2 and can get back to full activity. It's unusual to have persistent symptoms, but they do occur. One thing that when we did this survey and evaluated our clinic, one thing that I found interesting was that 22% of the kids never told anybody about their concussion. And that's actually lower than what are published reports, but 40 to 50% of kids who experience a concussion may not tell anybody about it. And that's an important part about the educational piece and running a program. And we published the results of that pilot study, and we've worked on that in an ongoing fashion. Just moving through 1 or 2 things at the end here, are there pharmacologic measures known to help in treating patients with a concussion? Analgesics may be helpful. Melatonin, if their sleep is disordered. These are all things that have been advocated, but the evidence for it is very sparse. And broadly speaking, we don't start with medical therapy. We start with brain rest and see where that takes us. Amantadine for some slowing, amitriptyline possibly for headache management, and then ultimately additional therapies like neuropsychologic care, physical therapy, speech therapy, working on cognitive function, but ultimately rest is the mainstay of management. Future research, well, I've talked a little bit about how force may or may not be the solution. So limiting the force that athletes are exposed to may help the problem or may not, because as I said, brains may be uniquely sensitive to the development of the problem unrelated to force in some fashion. So imaging, and I won't go into too much of this. Dr. Grafton, as you mentioned, and Dr. DeLeo have been doing studies with this out at UC Santa Barbara, looking at functional MRI to see if you've been subjected to an event or if you have symptoms, maybe we can find imaging for that. And they, in fact, received a grant from the NFL, one of the few centers around the country to do that. So we have a highly sophisticated program at UCSB run by neuroscientists from the community. So where can Cottage lead? Where are we going to go from this? Well, currently we're looking at regionalizing and standardizing the management of youth concussion within the Children's Hospital. And then ultimately, I think we have the opportunity to longitudinally study the effects of brain trauma in youth athletes, talking about their symptoms, their imaging, and their cognitive function. We have a unique constellation of a controlled environment where we have imaging, neuropsychologic testing, a neuroscience institute, a trauma team, all integrated in a fashion that many communities do not. So I think this is a ripe area for us to continue research on going forward. Anyway, I thank you for your time, and thanks for the invitation.